Hi there. I'm Dr. Steve Cohen, and I'm the medical director of Faces Plus Plastic Surgery Skin and Laser Center. And I hope everybody's doing well today. I wanted to try to clear up some confusion. One of the things that we're doing is something called injectable tissue replacement. And people always ask me, well, isn't that the same as fat grafting? And the answer is yes, but no. Fat grafting just implies taking fat from somewhere else on the body and injecting it into the face, for instance, to make the cheek look pretty or to make the lips look pretty, or basically using fat as a filler. And one of the things that's happened, fat as a filler isn't like a filler because fillers are more predictable. They've been modified into different shapes and sizes so they can be used under the eye or in the fold or in the cheek, because substance in the cheek is going to make the cheek pop and look good, whereas you don't want substance under a lower eyelid because it'll look bumpy and lumpy, and obviously that's not what people want. So fat has gotten a reputation in some ways as being good and bad because people have never really modified the fat into different types of components. But what people don't understand is fat is not just there for insulation or to make your pants feel tight. Fat is also full of stem cells, various regenerative cells, growth factors, and works in concert with the bone marrow to heal wounds, to resupply stem cells to organs that require some repair. So injectable tissue replacement takes fat and modifies it into three different shapes: a structural fat that's used for the cheek, a thinner microscopic fat that might be used for the surface of the forehead or for your hand, and then a very fine, almost liquid fat that probably contains almost no fat, but the other contents of fat called matrix that has stem cells and regenerative cells and growth factors. And that's used for very thin skin and even for wrinkles to try to plump them up and to reestablish their collagen. So when we talk about injectable tissue replacement, we are replacing all of the tissue, especially the fat that's been lost in the face with aging. And what this does is you begin to make new blood vessels, you increase your facial mass because some of the fat graft survives, and you replace in very specific compartments of loss the exact size of the fat graft that already is there. So in many ways, injectable tissue replacement is like maybe home maintenance. You know, your carpet gets worn out, you replace the carpet, yes, you start walking on it again, and it gradually gets worn out. But what we're doing with injectable tissue replacement is we're replacing the volume you've lost as you've aged, and once you reach a point where you look in the mirror and say, I need more than one filler, it's because you've lost fat in the superficial compartments and in the deep compartments. That's why we've created this new concept and this new technique called injectable tissue replacement. I hope that clears it up.
And would you say, like, since ITR is like new carpeting and new flooring, that just standard filler injections are more like a house plant that you add for its, aesthetic purposes,
right.
But it's going to die and you're going to have to keep getting new house plants every couple weeks?
I think that's a very good analogy, and I think that fillers will predictably go away. They have a little bit of positive interaction with your tissue, but by and large, they're decoration and they enhance your appearance. Nevertheless, you continue to decay. When we do injectable tissue replacement, we're actually putting back the material that has decayed. By definition, we have just reduced the rate of your tissue decay. As far as I know, this is the only way that we're able to do this.
And then can you show us on the app what it looks like
Sure.
when this happens to your face? So Dr. Cohen has an app that he's developing for other doctors to learn his unique technique of injectable tissue replacement. And this is a prototype of the app here.
So what we're showing initially is really just aging of the face. And as the face ages, it begins to sag and lose volume. And this occurs in the fat tissue both beneath the muscle and above the muscle. Well, what we're able to do is harvest fat from your abdomen, and this doesn't even require an incision. It's really not a surgical procedure.
It's kind of a bonus.
It's a bonus. It's a little needle puncture. And once you harvest the fat is processed, and then the fat is injected in the face just like you inject a filler, a little needle puncture. And in this case, we're injecting the fat in the deep compartments behind the muscle because that's where the fat is being lost in some situations. We're injecting it deep in the temple. But in other situations where we want to be more superficial, for instance, around the lips or in areas like the surface or just below the surface, the fat is put in really just like a layer of new carpet. But this way, we're able to replace all of the fat. And then lastly, we're able to do what's called nano fat, where we're literally putting the fat in the very fine wrinkles because we're trying to reestablish dermal thickness or skin thickness. And this is why this is very unique and very different. And this is kind of just a model and a little app that allows people to understand this a little bit more predictably. Thank you.
Thank you so much, Dr. Cohen.